Guess their age, guess if they're natural or not, say what you think they have done.
Okay.
The first girl is Jess.
38, lips, nose. Yeah, so obviously she had some work done.
And then Jess is 25.
Wow. I think that, plastic surgery and injectables done incorrectly can make you look older. Boy, I was really off.
Botox is making you look old. And I see a lot of girlies on TikTok doing so, which is causing them to look older than what they are. Unless you have the appearance of lines when you're not smiling, frowning, and when your face is neutral. The earlier you get it, the earlier you're gonna have to rely on it. The reason why it's happening is because people care about your money more than they really care about your appearance.
Hello Nice Stars. So before I begin, I would like to say that I'm very thankful for the last video that I did that was about fetishism that actually blew up quite a lot for me who just started my channel, and I didn't actually think that people would be that interested into it, but seeing that people actually watched it and enjoyed it and thought this topic was interesting, I felt good. It felt good that people liked it too, even though it's a very sad reality that we have to live in. Is you can find things interesting and at the same time But on today's topic is about Botox. Now, Botox has become a very huge thing nowadays. I think it was like a few years ago or something. It wasn't that long time ago people started to use Botox. But the reason why I wanted to talk about Botox was when I stumbled on a video that was about a plastic surgeon that was gonna guess the Love Island's contestants' ages and procedures that they might have done.
Guess their age.
Okay.
Guess if they're natural or not. And then say what you think they have done.
Okay.
Okay, so the first girl is Jess.
She's 38, lips, nose. Yeah, so obviously she had some work done, in my opinion.
This is Harriet.
42, yes. Cheeks, lips, nose, fake lashes, brows,
Okay, perfect.
Botox. She's 35, lips, veneers, Botox, maybe a little cheek filler.
Is Samantha.
32, lips, veneers, nose, cheeks.
Do you want to hear their
Botox.
ages just for fun?
Yeah.
Okay, so Samantha is 26.
Oh God.
And then the girl above,
Yeah.
Nicole is 24.
Oh my God.
Harriet is 24.
Oh my God.
And then Jess is 25.
Wow. Yeah, I mean, obviously I don't watch this show, maybe I should, but this is crazy. Yeah, I mean, I think that, plastic surgery and injectables done incorrectly can make you look older. So, boy, I was really off.
As you can see, as he said, Botox, fillers, and plastic surgeries can make you look older than you actually are. And it made me kind of, question if Botox actually makes you look older. And before we start, we need to know the difference between Botox and fillers. Botox contain purified bacteria that freeze muscles. In doing so, Botox can help minimize the appearance of lines and wrinkles caused by facial expressions. Dermal fillers contain ingredients that add fullness to areas that are thin due to aging. This thinning is often in the cheeks, lips, and around the mouth. if we're talking about Botox, we're talking strictly about injecting Botox in order to cause as little wrinkle as possible. Because what Botox does is that it will inject itself into the muscle to freeze the muscle, so that whenever you try to make expressions, those muscles will freeze up so that you wouldn't get wrinkles. That is the theory behind it.
When you get a Botox injection, you're actually injecting a toxin into your face. This toxin blocks nerve signals in your muscles, which temporarily paralyzes the area. This causes the muscle to relax, which is how it reduces the appearance of wrinkles. Now, Botox gets a bad rap because some people tend to overdo it, but the injection can also help with other conditions like excessive sweating and migraine.
And I wanted to also know what it looks like when you have Botox and when you don't have Botox. So what I found is that Botox are usually injected in the forehead area, the eyebrow area, and in the eye lines right here. Because you squint, you get a little bit of wrinkles, so they like to inject it around here. There is also when you have smile lines, when you smile a lot, then you can start to inject here. So the thoughts of, you know, using Botox in order to Botox is used because people don't want to look older or age. They want to stay youthful. And personally, I think that there is nothing wrong with, getting older, getting wrinkles. And it's something I don't particularly like about Botox is when people use it on their smile lines, for example, because I think smile lines just tells people that you like to smile a lot, which isn't really an issue or a problem. I don't see it as a problem, but apparently people do. I don't know how people are willing to do that to their own face. But there is Brace, I think her name is, are going to tell what it feels like to have Botox.
Okay, I just got Botox, and I want to describe Botox to someone that's never had Botox before. A lot of my friends haven't gotten Botox yet, and other people haven't. When I say, oh, I just got Botox, people will ask me, what does it feel like? And I have the best description. I don't think I could possibly explain it better. Okay, so picture you have hairspray, and you just spray your forehead. Just a nice coat your forehead. And then I want you to take your forehead and then try to raise your eyebrows up and down. And the hairspray is hard, okay? And it's pushing on your forehead, and you feel this weird film layer kind of when you raise your eyebrows, but they don't let them go up all the way because the hairspray is really hard. That's what Botox in your forehead feels like. So if you want to try it, spray hairspray on your forehead and see what that feels like.
Personally, I don't know why anybody would like for it to feel like hairspray getting stuck there and you can't really lift your eyebrow or lift. Mostly people get it done on their forehead and eyebrow. So this part of the face, you wouldn't be able to move. And I've noticed the more people get Botox, the less expressions you will see on their face, because they can't move those muscles because Botox frees those muscles. So you just can't do eyebrow raises. People like what they like. I wouldn't want my face to feel like I couldn't move it, but anything for less wrinkles, I guess. But then also Some people say that some people use Botox to less migraines and headache, which I'm not gonna go further into that research field because I don't think it's relevant in this topic right now. But I think it could be another reason why people use Botox. But in this case, I'm strictly talking about aesthetic reasons, like beauty reasons. There's another girl that has done Botox and going to share her experience in why she does Botox.
My name's Lex, and I started Botox at 23 years old. And I'm not even slightly ashamed of that. I do find it really, really interesting, though, that it's always people who claim to be feminists and trying to dismantle patriarchy that come online and bully other women for the choices that they make for themselves and their skin and their bodies. The whole point, babes, right over your head. Right over your head. But regardless of whatever opinion you have on what I did to myself and my face, I do want to reel us back in and talk about why someone would choose to get Botox at 23 years old. I'm about to turn 28, and I do not have a single fine line or wrinkle on my face. And as someone who has addiction in their family and whose parents have aged considerably worse because of their addiction, I had a priority in my life that I was going to take care of my skin and not follow in those footsteps. I also chose quite possibly one of the most stressful jobs on the planet, nursing. So at 23 years old, I was a baby nurse. I had just gotten through nursing school and I had already tried to myself twice, right? Lots of stress. I also survived a highly abusive relationship when I was in nursing school where the guy tried to me. So, I was already forming some fine lines and wrinkles right in here from years and years of repeated trauma and a lot of stress. And I personally did not want to visualize that trauma and stress on my face. So again, thank you for your judgment, but it's a choice I made for myself. And reverting back to science, when people do start using Botox at ages like 23 or in their early 20s, it's very low doses. And those low doses pretty much just guarantee that the muscles are relaxed enough to not form the scar tissue that will then go on to form fine lines and wrinkles. Now, I also have EDS, Ehlers-Danlos syndrome, which means that my body's skin does not produce some of the compounds that keep it looking young and youthful at the same levels that other people's do. So I'm even more predisposed to forming those fine lines and wrinkles on my face, and I just didn't want them. And I think that that's totally fucking fine. And it doesn't make me a victim to the patriarchy. What really made me a victim to the patriarchy was the fact that my ex, after trying to me and 2 other women, only got 30 days in jail. 30 days in jail. That's more of a threat. I feel like we should be using this energy maybe directed at other things. But once again, didn't want to wear that trauma, didn't want to see the visual aspects of my disease on my face, and I made that choice. And now I do not have to use as much Botox later down the road because I started early and I formed basically a protection mechanism from those fine lines and wrinkles ever forming on my face to begin with.
That was a lot of information at once, honestly. But so her reasons to wanting to do Botox is to not get wrinkles and not to look as old due to her parents, also due to things she has experienced in the past, and she just didn't want to look like it. I mean, what can I say? Honestly, I don't know, because like, fair enough. If people gone through, I would say, like, in her experience, it was like when you live through a trauma, there's always some sort of scar, mentally or physically, and for her it is more physical. where you can see on her face, and maybe she doesn't want to be reminded every day that those wrinkles and those looking older, and there are some signs with that stress cause aging. Not gonna get further into that, but there is some sort of evidence into it. Too much information at once that I wasn't ready to deep dive myself into, but I can make a video about how stress affect your body and stuff. I can definitely do that in future. But right now, what I'm trying to say is that she doesn't want to see it physically with all the things she's gone through. So she uses Botox to look without wrinkles and youthful and not getting reminded of that. Which I'm like, okay, like, I get that. But for me, it's such a complicated topic, because when I think about that, her reason into it, I'm like, okay, that is like valid, I think not wanting to see that with all the things you've gone through is valid to do. But then I also have another side of me who's like, there's like nothing wrong with looking older or having wrinkles. It should be something we should accept instead of having to use those kind of procedures in order to like fix them, when I personally don't think there's something, I don't think it needs to be fixed. It's something people feel like they need to fix. And something you notice with these women is that they start very, very young, in their 20s. The thing is, when you're in your 20s, you're still very, very young. Everything is still developing. For example, if we're talking about the brain, you're still the prefrontal cortex. I cannot pronounce that at all. It doesn't develop fully until you're 25, even maybe 30 if you're immature like some people here. And if we're talking about your skin, for example, what I'm trying to say about skin is that you're so young and the skin is still developing, and you don't really know what Botox is gonna do to you as you use it many, many years, and also how your skin going to react to it. That's, you're still so, like, for me, it's like, why would you do this in your 20s? Because like, you're so young, you don't know what your skin are going to be like in like 25 years, not 25 years, when you're 25, 30 years. And I think like, maybe it doesn't matter, because like, the reason why people do Botox so early is because when you're in your 20s, you don't really have a lot of wrinkles, and that's when you can like freeze those muscles. So when you get into your 30s, you still don't have any wrinkles, right? But a doctor is gonna tell us if it's worth doing your Botox in your 20s.
Is Botox worth it in your 20s?
So Botox is actually a medication that helps relax muscles that cause wrinkles. It's not as effective once the wrinkles are deep. It won't just magically make them all go away. And so by doing preventative Botox, it'll prevent you from having to do things like laser treatments to help resurface the skin, or filler treatments to try to reduce the wrinkles in a different way. Somebody who might be in their 20s who is very expressive, who already is starting to have deeper lines, if their goal is that they want to look younger for a longer period of time, the baby Botox will be helpful because it'll keep them from developing really deep wrinkles. Down the road, you don't have to even like spend some money on other things that you might have to if you had not done the preventative Botox.
The doctor says if you have deep wrinkles in your 20s, then it might be optional for you to use preventative Botox so that later in your life you wouldn't have deeper wrinkles that will last, forever. I just think like, yes, if you want to look youthful, stuff like that, great method. But I personally think we need to think deeper into the reason why we want to. And that is when you get into the more society standard of how, especially for women, to look as young as possible, and how important that is. And I can get more into it because like it's not just the Botox that women are using to look more young. There are so many things I see on on my social media, for example, anti-aging straw, because you're not supposed to get wrinkles around here, using different weird gadget laser stuff mask because it makes you more young. At the inner core, I think the reason why people do Botox so much is because it is effective, and because most women in the society standard need to look young. It's so sad. It's super sad that these procedures are done so much, because we're gonna get into what happens when you use Botox a lot.
Doing Botox for a period of 10 to 15 years just kind of puts you in a time chamber or a time saver. What happens if you've started Botox and then you decide to stop it at a later point in life? Nothing. Your skin will just slowly build up wrinkles again and pick up where it left off. Doing Botox for a period of 10 to 15 years just kind of puts you in a time chamber or a time saver, that you just are not putting tension on those muscles and the skin for that period of time. But as soon as you stop it, things will revert back, your muscles will gain strength, and you'll start to form wrinkles again.
And I want to say that the woman I am going to present, I'm not saying she does a lot of Botox. What I'm saying is you can tell that she has done things on her with her face, and it makes her look older, whatever that is, like Botox or surgery or fillers. I'm not quite sure, but when I saw this video, it made me think. And I want you to guess how old she is.
Respectfully, you look like you're pushing 45. Stop getting filler or Botox, whatever you have. It looks so bad. 45? I get maybe late 20s, 30s. 22, yeah, shocker. When I first started TikTok and started making filler videos, like come get filler with me or Botox, I used to get these hate comments all the time. There's just people on TikTok that absolutely hate cosmetic procedures and believe that you shouldn't get them. And again, I think it's a personal preference. Like if I want to get filler, I feel like no one should stop you from getting filler because it's your own face. But people always told me that I look older, and I get it. I look older. I might act older. But 45? And before, I used to cry over these comments and used to delete them and block the account. But now I'm just I just laugh at it because I know it's not true. But I do respect your opinion.
How old do you think she is?
Her? 38, 40.
Okay.
How old is she?
I think she's in her mid-20s.
You better fucking be kidding.
No, I'm not kidding. She's like in her 25. She actually did say what her age was, and it was 22, and I'm just dumb and didn't think about it. So I apologize for her and myself. But maybe you can tell that she looks older than what she actually are, and it could be due to the fillers, which we talked about, that fillers and Botox are not the same. Fillers, you usually put it on your lips to make the lips look fuller. So for example, if I were to get filler, I would have taken a little bit in my lips so that I have more plump lips. And Botox would be, you know, wrinkles that she might develop. And cosmetic procedures, I don't know what she's done on her face, but you know, and this is like with the Love Island plastic surgeon that talked about Botox fillers, plastic surgery, and then with her, you know, admitting that yes, she has done cosmetic surgery like fillers and Botox, and they are showing that, you know, when you get that done, you can look older. It makes me start to think, like, do Botox age people? And this is where another doctor talk about if Botox age you.
You've probably never heard that Botox can actually make you look older, and I'm the only dermatologist that'll probably tell you this. Botox is injected into the muscle and stops it from working, which is a good thing because we don't crinkle up the skin and we don't get wrinkles. But when you start getting Botox in your 20s and you're going in every 3 months for years and years and years, you're not allowing the muscle to work. Facial muscles are like any other muscles. If you're not using it, you're losing it. So it's important to take breaks. I recommend Botox break cycling, where every 2 years you go down by 1 Botox session. This allows the muscles to work so you don't lose it completely.
I'm guessing that the reason why you would want to use less Botox or having break cycles is, like she said, if you don't use your muscles a lot, it will, you know, lose its function, and that's when it, what do you call it? Droop down. Then the muscles have to start working again, and then you have to start using those muscles again, you know, kind of like training. The more training you do, the more active they are, and the more stronger they get. That could be a reason to look old. Let's hear it from another girl that wanted to do the Botox but didn't.
Botox is making you look old. Watch this if you are considering getting Botox and you're in your 20s. Because of social media, I found myself in a nurse injector's chair at the age of 25. She pulled out this book in which I wish I took a photo of, and it showed different races of women and their aging cycles. As you can see what type of woman I am, we only have 4 aging cycles in comparison to other races. Because of this, we do not follow the same beauty standards as other races, and I see a lot of girlies on TikTok doing so, which is causing them to look older than what they are. The nurse injector told me that there should be no reason why I'm getting Botox and I'm not in my middle 30s. So she also said even then, she doesn't even do Botox on girlies like us until they're around 40 because of our aging cycles. Unless you have the appearance of lines when you're not smiling, frowning, and when your face is neutral. The earlier you get it, the earlier you're gonna have to rely on it. And not only that, the reason why it's happening is because people care about your money more than they really care about your appearance. Long story short, the nurse injector refused to do Botox on me, and when I left her office, I find myself Googling other nurse injectors to do Botox instead of listening to exactly what she told me. Am I the girlies off of Botched who get the surgeries and they get turned away and then they go to Thailand? Well, I did not end up doing it, and I'm really glad because I see some of the girlies and they look really old for their age. So S on my chest because I'm ready to save y'all, or whatever Nikki said. Put down the Botox, cancel the consultation. It is not worth it.
In this video, I think one thing that I picked up on that I haven't heard before is that different ethnicity have different, what would I say, aging patterns, and it differs so much that depending on your ethnicity, then you should think about when you should get Botox and when you shouldn't get Botox. And I have never heard about this before. Like, I've heard about Botox so many years. You know, it's been on my feed for so long, telling me how, you know, Botox help you, and Botox is the new way of cosmetic surgery, and it is great to be youthful and young. But no one really talks about, depending on your ethnicity, it's gonna be different for you. I went more in depth about this, so let's see here. Skin characteristic and aging patterns often differ across ethnicities due to genetics and environmental factors. These distinct psychological variations significantly influence how individuals respond to treatments, such as Botox. And this is where we get into when different ethnicity should do Botox. So Caucasians' faces show often early signs of aging, like fine lines and wrinkles. Botox is frequently used for forehead lines, frown lines, and crow's feet. For Asians, in many Asian cultures, a youthful, smoother skin is desired. Botox might be used for jawline slimming and treating forehead lines and crow's feet. Africans' skin is generally thicker and shows signs of aging later than other ethnicity groups. Botox could be used for dynamic lines on the forehead and around the eyes. Hyperactive muscles around the nose area might also be treated. Hispanics, similar to other ethnicity groups, Hispanic might use Botox for treating forehead lines, frown lines, and crow's feet. A strong emphasis might also be on jawline and neck aesthetics. I learned a lot about what Botox are used, and I don't know how to feel about it. So apparently there's more reason people use Botox. It is for slimming your jawline and on your neck. How does that work? Why would you want to do on your neck?
Get wrinkles in your neck too?
You do?
Yeah.
Botox gonna work differently for different ethnicity groups, and apparently Africans don't need Botox until later in life. It's mostly Caucasians that have to get that done earlier. Asians and Hispanics are like in the middle somewhere there. If you decide to do Botox in your 20s and then proceed for many years, what is the side effect of it?
Yes, getting Botox injections can cause long-term side effects. I just got off the phone with a person that got Botox injections 10 years ago, guys, and she was disabled 10 days later. Now, since then, she's been having a lot of immune system and neurological issues, and she just recently was diagnosed with POTS. So a lot of the times, this can disrupt your autonomic nervous system and can cause severe side effects for these patients. So what we are trying to do here, guys, is to accept your body for what it is and to avoid toxic injections that can cause severe heart rate issues, severe neurological based issues, as well as immune system triggers down the line.
The horrifying truth behind the paralyzing toxin that can cause irreversible damage. Botox may seem like a quick and easy solution to smooth out wrinkles, but the truth is, it's not only dangerous, it can also be deadly. Botox is a neurotoxin that works by paralyzing the muscles in your face. However, this paralysis doesn't just affect the muscles in your face. It can also spread to other parts of your body, causing serious health problems. Studies have shown that the paralysis caused by Botox can disrupt the neural pathways in your brain, leading to mood disorders and other mental health problems. Embrace your natural beauty and look into other much more natural methods, such as using kinesiotape, acupuncture, cupping, and facial massage. All of those techniques work on relaxing the connective tissue, leading to beautiful and smooth complexion.
Alright, if you start using Botox in your 20s and you keep doing that for many, many years, you might not only look older than you actually are, because I think the more Botox you use, the more when you stop using it. For example, if you stop using it, your muscles in your forehead or whatever you just put it in, they haven't worked for many years and you might droop, making you older. But also the more Botox, and also if you use fillers and plastic surgery or cosmetic surgery, all of that is gonna make you look older, as we have seen with the Love Island contestants. Will you look older with Botox? Not always. It can also be different for a different ethnicity, depending if you're Caucasian, Hispanic, Asian, African, due to our skin variation and our aging pattern. It will completely look different for everybody. So if somebody look older than they are and they're using Botox, it might just have been because they're like in different ethnicity, or they use too much, or they just stopped. That's not the only thing you have to be concerned about. Botox can be harmful for your body too, because it can cause severe heart rate issues, neurological based issues, and immune system issues, which is, I don't understand how people are willing to take that risk. The more danger about it is that it harms your body, like heart rate issues. Your heart, you only have one heart. If something goes wrong with it and you need like heart transfer, like, do you know how long you have to wait for a heart? And I don't know how people are willing to do that. I think people have Botox every third month. So going to that Botox place and get it done every 3 months or something, or even half a year or something, like for many years. Jen from my future here, I didn't think about it until I started editing that you can look older with Botox due to surgeons' malpractice or their willingness to get money out of you more than actually like making you look youthful. So if they don't consider your ethnicity and they don't consider that they have placed the Botox wrong and just did it because they get money from it, then it's gonna make you look older. Yes, so that's that too. Before you get Botox, yes, even if it works, think before. Do you want to harm your body? Maybe getting these side effects? And also, what is the deeper reason to why you want Botox? Is it because of the society standard that says that you have to look young? Or is there a deeper reason for yourself? For example, the woman that did it because of how she didn't want to see it in her face with all the trauma she's been through. And are you willing to do that like every 3 months for many, many years so that you can look youthful for like maybe 10, 15 years? And also note that depending on your ethnicity, you're gonna look very different. So I still complicated on this subject, on this topic. Bye bye.